to the audience and panelists that came today. Today about our panel discussion, the topic that to discuss is out of wedlock babies is on the rise. We discuss this topic because it is very hot issues. If we look at the current statistic, it shows that 4,992 illegitimate children were born to young mothers aged 18 and below in 2017. This case is increased from year to year and it caused more wedlock babies. So, at the end of this discussion, hopefully that all the information that given by the panelists is useful. Without wasting our time, let me introduce all the 4 panelists that were invited today. Thank you to all the panelists that coming today. So, the first panelist that were invited to this panel discussion is Professor Ainul Mardia, the professional counselor that had attended many events like this. Hello, Prof.
Hello.
Thank you for coming today. So, the second panelist that joined us is Nur Nafisa Khadija, an officer of Ministry of Women, Family and Community Development. For the past few years, she had received many cases of wedlock babies that occurs in Malaysia. So no wonder that she is very busy person, but she can attend to this panel discussion. Hi Cik Nafisa.
Hi.
Thank you for coming today. So the third panelist is Erina Sophia, professional doctor of HIV disease. Hello doctor. You look nice today. And the last panelist is General Inspector of Investigation, Nurul Farah. Hello Inspector.
Hello.
Thank you for coming today. So, I won't go through the question. I want to ask the opinion to the inspector about this case. Inspector, can you give your opinion about this issue?
Thank you to the moderator. In my opinion, this case might be affected to the baby, that the children should not be humiliated because the position they find themselves is in without with their kids, but with their parents. Simply hide the sources of moral and social exclusion and discrimination suffered by illegitimate children. It's just logic perhaps that suggests these children may actually be without emotional and intellectual sense.
Thank you, Inspector. I agree with your opinions. Okay, how can they do that, right? So, did they not feel humiliated? So, for the second opinions, I want to ask to Cik Nafisa. Cik Nafisa, can you give your opinion about this?
Okay. Assalamualaikum warahmatullahi wabarakatuh. In my opinion, as an official of Ministry of Women, Family and Community Development, yes, there are many children nowadays are born to parents who are not married to each other. It is important for such children to be recognized and given the rights to parental care, because parental care is a very child's right. Refers to statistics, we can conclude that these topics are getting worse day by day. So it's time for us to wake up, especially the parents, from these important issues. Babies especially will become a victim of their parents' mistakes. As we know, majority Islamic country that preventing sex before marriage, but many things have been out of wedlock due to were forced to who forced to throw their babies desperately due to shame and fears of resulting consequences. So, as an official of Ministry of Women, Family and Community Development, we should help them. We should help them who are already not involved in the case, or maybe already involved in the case. So, to find a solution for these issues.
Thank you, Cik Nafisa, for your opinions. So, back to the Inspector Farah. What do you think is the reason about this case is on the rise?
Okay, thank you to the moderator. In Persalinan Raya, an average of 140 children were born out of wedlock due to Muslim mother each day. According to Berita Harian report, National Registration Department statistics shows that the total of 159,725 children were born out of wedlock to Muslim mothers since 2013. Of this number, 53,492 were born in 2013, 54,614 in 2014, and 51,169 in 2015. In the report, Ikatan Muslimin Malaysia, ISMA, Women's Chief Dr. Nursalihah Muhammad Saleh was concerned over the high number of cases and called for urgent action from the relevant authorities. She said the problems stem from shallow religious education and morals, and added to all the religions reject the premarital sex. The roles of parents was also critical in ensuring a younger generation with positive morals and minds. She says the parents should spend as much time as they could with their children, so that the children not feel ignored and seek happiness out of home. She proposed that the Education Ministry increase the amount of time for Islamic education and moral studies at all levels for schools. Nursalihah also lends her support to the National Student Teacher Association proposal to strike a balance in the male sexual and reproductive health education that is said to be implemented. Sexual relationship is between male and female. There needs to be clear balance by teaching stages of both of genders so that they don't get caught up in premature sex.
Thank you, Inspector Farah. I think it's a very good reason, and it shows that this is the major reason why it was happen nowadays. So, Professor Ainun, can you tell us what is the emotional and mental impact to the person that involved in this case?
Thanks to the moderator.
Yes, okay.
There are so many bad effects and consequences that will affect a pregnant woman, especially for a pregnant teenage. It not only common problems, but it more than a mental, social, financial, and high risk effects. A pregnant teenage actually at a high risk of mental disorder such as depression, stress, anxiety disorder, or maybe they can also get a bipolar disorder. So I think as a counselor, the main factor that give effect from this problem is the less support from their family and their friends. They feel so ashamed and afraid to share their problems and their secrets to their family and friends. So they isolated themselves to hide their pregnancies, and I think it was a bad effect for a teenage who involved in this problem.
So, Prof, how about the family?
Okay, for when a pregnancy occurs, it actually also affects their family. especially their relationship among their family members, they need to decide whether they want to take care of the baby or give a baby for a foster family. So, last from me, this teenage pregnancy involves a legal issue that adds stress to their family members.
Thank you, Prof. So it's quite dangerous when the person involved in this case, right?
Yes.
Okay. Dr. Erina, what is the most dangerous disease that can affect to the person that involved in this case? Can you tell us, please?
Yeah, Assalamualaikum. First, the person more likely to get AIDS or another STD when the person has one sex partner or many sex partner during their lifetime. AIDS is the end result of infection with the virus HIV. HIV attacks the body's defense system, making the body less able to fight off the infection or cancers. People with HIV may not have no symptoms, or maybe they not even know that they have HIV. To cause infection, HIV must enter the bloodstream. This can happen during anal, vaginal, oral sex, or by sharing needles, or work with the person who has HIV. I think that's all. HIV also can be passed from a mother with HIV to her baby during pregnancy and delivery to her baby at birth. Can greatly lower the chance of a baby becoming infected with HIV. Without treatment, this disease can lead to major health problems such as sterility, which is not being able to pregnant, permanent brain damage, heart disease, cancers, and even death.
Yes,
That's all.
So they better get treatment quickly if do not want anything bad happen to them.
Yes.
Okay. Cik Nafisa,
Yes.
if the person is already involved, so what is the preventive measures about the wedlock babies?
Okay, thank you to the moderator. Most abandoned babies are born out of wedlock with their mothers afraid to ask for help. What make these unwed mothers? Okay, what make these unwed mothers dump their own flesh and blood? Most of unwed mothers had compassion for their children, but were left with no choice as their family and society would not only have punished them, but also shamed them as well for having babies out of wedlock. And unwanted babies have been dumped in some of the most appalling and cycling places such as toilet bowls, rubbish dumps, rivers, garbage bin, and also abandoned buildings. As long as society continues to attach a stigma to unwed mothers and babies born out of wedlock, unwanted babies will continue to be a social problem in our country. So our party has made a few alternatives about preventive measures on these issues. Okay, first and foremost, we are provide sex education on family planning and parenting responsibilities. Then parents should have a dialogue with their children about sexuality and responsibility to their children. And Minister Datuk Seri Dr. Wan Azizah said, our party has prepared shelters for children who need protection and also recovery, especially who are involved in pregnancy, out of wedlock, and prostitution, such as Taman Sri Putri was established recently. This is to make sure that they are not dumping their babies again, and we want them to give love and care to their babies as like other mothers do. They stay young and do not have even knowledge on how to taking care of their babies as they are not given enough education about all of this stuff. So we will give protection and also taking care of them until they give birth. to their babies, and also we will teach them on how to manage their own children, as that are their responsibilities to do so. And lastly, we also make a cooperation with non-governmental organization (NGO) and Yayasan Open Care through a baby hush program for reduce this dumb babies case. This is also to make sure that wedlock babies are in protection under the party consent. That's all.
So make a cooperation with non-governmental organization is one of the preventive measures, is that?
Yes.
Okay, thank you from Cik Nafisa. So back to the Prof. Ainul. How to deal with a pregnant teenage child?
Alright. So the best way to deal with this pregnant teenage, first is we do not continue to scold the child if it gets the bad news. We should ask them first about their health, be a soften first, because they need a proper guidance regardless of the situation. Maybe this teenager are pregnant because they are a victim of rape and disease, so we should identify the true situation first. Then, although their bodies are a mature person, but their psychological thinking maybe are still immature. When they are pregnant, that's when they need a proper guidance, especially and support, especially from their parents, to solve the problems wisely. We should be relaxed to ask the child to tell the truth. Take your daughter to a doctor to confirm your pregnancy, and do a police report and get help and reference from Department of Social Welfare (GKM) if necessary. And last but not least, as a parent or a best friend, you should give a positive word and encourage so that they do not experience depression and mental disorder. So that's all.
Thank you, Prof. Ainul. I hope parents out there can manage their children well so that their children did not stress when they pregnant. Okay, before we end the panel discussion, I want to open the question to the audience that want to ask question to the panelists.
Hello and Assalamualaikum. I am Aina Afika and I would like to ask question to Dr. Elina. How do we know if the teenagers are pregnant? I mean, what the difference between the normal people or the pregnant teenager? Thank you.
Thank you for your question. There is no significant difference between adult women and pregnant women. Some are suffering severe anxiety eating something, do not hold on smell of food, and others. It often occurs in pregnant women at an early stage, but some are not directly affected. They are usually more fit and rarely feel tired. In terms of emotion, there are teenagers who are depressed and alone if they are in a state of fears of pregnancy. Parents need to think that their children is pregnant if their children showing the sign of pregnancy. The abdomen is growing and there is a change in the skin color at the abdomen and breast. That's all.
So it's all from Doctor. Okay, we have done for our panel discussion. Thank you for all the panelists that came today. I'm sure this topic out of babies can help people out there overcome their problems. Besides that, this topic also give more information to the people around us that directly involved or indirectly involved. Let me conclude a little bit about this topic so that parents and audience clearly know that The major reason for teenage to involve in this case is because parents not spend as much time as they could with their children to ensure they did not feel ignored and seek happiness. Furthermore, more preventive measures for the children that already involved, such as prepare shelters for children who need protection and recovery, so that maybe they feel relief and regret for what they had done before this. So that's all for our panel discussion today. Thank you.